Good morning, folks. Just wanted to update you with a little video, help you on your assignment today a little bit, and then follow up some on your assignments from the introductory module. So I'm already here on module 1, try to save a little time. So today you've got the injury profile due, and I realize this will be the first time that some of you have done this. So I kind of wanted to talk through how this works and what you would be doing. But I'm going to also use it to show you the feedback feature. And so this is my student page. Your student page should look like this. On all of your assignments, I can give you feedback. And so on a couple of your introductory assignments, I've given a few of you feedback. It's always going to be listed right here on the assignment. And so you'll also get you should get an email to your TLU email. I know the TLU email function is not working right for everybody. So if your TLU email isn't working, you might want to, the day after something's due, just kind of check back and see if you have a comment, and I'll try to email you directly as well. But this will give you info on, if typically it'll be that I reopen an assignment or I adjust the grade or something. But you can always find it there, and you can always comment back as well. And if you comment back, it goes directly to my email, so I can get that. So the other thing I want to talk about was the injury profile. And so I've already clicked on the injury profile assignment through the module. Remember, the other way that you can get there is by going straight through the coursework tab. When you go straight through the coursework tab, you get a brief description of the assignment, but it's really important also when you get to an assignment to click this link to see the full description of the assignment. And so the full description will give you a little bit more information on it. And what the full description will also do is, if there's any sample files, there's always here at the end. And so you'll see that I've given you an example of what this should look like to kind of help you through doing this today. And so when you click on that, it'll open up your Word document. And here's the sample. And so really all I want to do this morning is kind of just talk through this a little bit so you have an idea of what you're doing and why you're doing it. What you're actually creating is basically a script that would be for like an actor who has the injury or the condition that I assigned to you through email day before yesterday. And so the case presentation is just kind of like a couple sentences just setting the scene. It doesn't have to be super specific at all, but it should kind of give an idea of generally what happened, even though we might want to know a little bit more, and how that person's acting. For instance, are you on the field evaluating them? Are you on the court evaluating them? Are they walking into the clinic? Just kind of, again, a brief intro to the situation. And so the first area where you might need a little bit of help is this differential shortlist. And so based on the case presentation of this kind of general intro that you've given, what the differential shortlist is it's a list of usually between 3 to 6-ish different pathologies or injuries that would make sense based on this initial presentation. Obviously, whatever your injury is should be in here, and that the intro should make sense for whatever your injury is. And so basically that's what we're going to be doing is for your injury is you're creating kind of a template of how this, in theory would present in an athlete or a patient. And so I want you to come up with at least 4, sometimes with certain injuries at 3, there's not many more than 3. You can always almost come up with at least 3. But no more than 6 injuries that would be on your short list. And this just helps me understand if you kind of understand injuries beyond just yours, that if I had, for this one, I forget what we're looking for, but if my injury I was assigned was AC sprain, that I understand enough about rotator cuff strains, clav fractures, or shoulder dislocations to understand that this case could present the same for those injuries as well. And then you're going to move on to the evaluation. So the evaluation is your actual script. We'll always go in the same order here when we're doing an evaluation. Oops, a little too far. We'll always start with taking a history, observing the patient, palpating the patient, looking at their range of motion, and then doing special tests. So basically from palpation through range of motion and special testing, we'll focus on how to do those during July and summer 2 when we're on campus. What we're focusing on this class really is interpreting the information that you get in the history, interpreting any observations or palpations. So it's really about understanding the injuries, and then next semester is about actually evaluating them. And so really, where I really want you to focus is kind of through these first couple areas. And so in the patient history is anything that the patient would tell us. So this would be kind of their complaints of their signs and symptoms, their more in-depth and specific description of what happened, where they complain of pain, what type of pain they complain of, how long it's been bothering them, what activities bother them, what makes them better, what makes them worse. And this is where you're really going to use your information about your injury and your knowledge of your injury to kind of create a sample presentation for your injury. Feel free to use any type of resources beyond what we've included in the class. You're not limited to those by all means. Definitely utilize your book, utilize the PowerPoints, but you're coming up with basically the classic scenario of how your injury would occur. Observations are things that we would see on the patient. So if they would have swelling or bruising or deformity, or any other visual, anomaly to normal, this is where you would list that for your injury. Sometimes there are no abnormal observations. If that's the case, you can just list that there's no abnormal observations here. And then palpations are areas that we're going to actually palpate or touch on their body to determine where they have pain and tenderness. And so ideally what you would do for this palpation area is that for all of your injuries on the short list, is that any areas of possible pain that they would have for any of these injuries, we want to note whether they have pain there or not. And so you can see down here for this one that we talk about, do they have pain over the AC ligament, because an AC sprain was on our short list. And yes, they do. They don't have any pain over any of the musculature, no pain over the clavicle, because again, that was on our short list, or across the anterior surface of the shoulder joint, because that's where we would typically have pain with a shoulder dislocation. So you'll start to see that all of these areas match the areas of possible pain and tenderness for injuries on our short list. And then range of motion, you can do a chart, you can do this narratively. I really don't care how you do it as long as you list it. You're going to be talking about or listing, the changes in their active, passive, and resistive range of motion. A lot of times for resistive range of motion, we'll call it manual muscle testing, which is just strength testing. If you need any type of refresher on what these three things are, the beginning of your book, I don't have it in front of me, so I don't know the chapter. I think it's chapter 3 or 4, talks about range of motion. You can refer back to that chapter in your book to help you. But basically what we're going to look at is what motions might be limited based on the injury that you've been assigned. And if they are, go ahead and list what those limits would be through here. For this first one, really, I hesitate to say this because I don't want you to breeze through it, but I'm not going to grade it very hard because I want to give you good feedback about what you're doing well and what you need to fix. So try to be thorough, but don't worry about being exactly right if you're unsure. And what will then happen is then at the very end of this, we would come up with our diagnosis, which is the email that I gave you. And so what's going to happen if you've done a good job on this, on your telemedicine assignment, so if this is mine, right, so this was my assignment and I made an injury profile for an AC sprain. On my telemedicine assignment, when I zoom in with, whoever my partner is, so my wife, she's going to ask me, all right, so what's going on? So I'll set the scene for her, right? Hopefully through her mind is going these types of things like, all right, sounds like it might be a clavicle fracture, maybe a rotator cuff strain, maybe a dislocation or AC sprain. And based on that, she's going to start asking questions that can help her determine which of these is more likely. And so hopefully all the questions she asks, basically my history, observation, palpation, can answer for her. And so I can have this kind of, laying on my computer in front of me to be able to kind of give them a script when she asks, exactly what was happening. I can tell her that, I was looking for an open player to throw to, and then, tried to shake off the defender, but kind of pulled me by my shoulder pads, and then the other guy hit me on the top of my shoulder. Obviously, since you wrote this, hopefully you know it a little bit, but there may be things that they asked that you didn't write down here, and so that's where it's going to be really kind of up to you to have a good idea of what your injury is, so that you can explain what that answer might be. And then hopefully on the telemedicine assignment, at the very end of this, if you've done a good job creating a good representation of your injury, and if they've done a good job about asking about these things, asking where, let me see your shoulder. All right. And then obviously you can't fake swelling, so they may have to ask, all right, do I see any swelling? And you say, yeah, there's some swelling over the top right here at the AC joint. If they've done a good job evaluating you and asking good information, and you've given them good information because you wrote it down, then hopefully they can come up with an accurate diagnosis here at the end. So that's how this injury profile and the telemedicine assignments will work. Again, make sure you go back and look at your notes for the intro chapter. There's notes for a couple people on both your introductory video and for your quiz. If you're having problems with things, don't stress out too much. I'm a pretty easygoing person. I understand that this is new for everyone kind of getting in. And so, for these first couple days, we're going to make sure that things get figured out, which is why we had the introductory module. And then we'll make sure as we get to some of the more advanced modules that we're really refining what we're doing very well. All right. Happy studying. Good luck on your assignments.